Hi everyone, I'm Dr. Eyetemou Miguel, your pharmacist, and in this new video, we are going to talk about diarrhea. I'm going to give you one tip that you can use for everyone at any age. If someone is having an episode of diarrhea, you can use that tip and you can make that is almost a medication that you can make at home with things that you find with ingredients that we almost all have in our kitchens. Three simple ingredients for you to prevent diarrhea complications such as dehydration. We saw the video by some key facts on diarrhea according to the WHO, the World Health Organization. The WHO says that diarrhea disease is the second leading cause of death in children from 0 to 5 years old. And it is both preventable and treatable for sure. Each year, diarrhea kills around 525,000 children under 5. A significant proportion of diarrhea disease can be prevented through safe drinking water and adequate sanitation and hygiene. Globally, there are nearly 1.7 billion cases of childhood diarrheal disease every year, and diarrhea is a leading cause of malnutrition in children under 5 years old. Talking about diarrhea, diarrhea can last several days and can leave the body without water and salts that are necessary for survival. Children who are malnourished or have impaired immunity, as well as people living with HIV, are most at risk of life-threatening diarrhea. Diarrhea is defined as the passage of 3 or more loose or liquid stools per day, or more frequent passage than is normal for the individual. So you pass 3, 4, 5, so 3 or more stools that are liquid or that are loose. This is a case of or an episode of diarrhea. Diarrhea is not a disease. It's usually a symptom of an infection in the intestinal tract, which can be caused by a variety of microorganisms. It can be bacteria, viruses, or parasites. Diarrhea-causing infections are spread through contaminated food or drinking water, or from person to person as a result of poor hygiene. Talking about dehydration, it is the most severe threat posed by diarrhea. During a diarrheal episode, water and electrolytes such as sodium, chloride, potassium, and bicarbonate are lost through the liquid stools, through vomit, through sweat, urine, and breathing. And then dehydration occurs when these losses are not replaced, and they can only be replaced by the food that you take in or by the water that you drink. So there are 3 scales or 3 levels of dehydration. The first one is no dehydration. You have no sign or not enough sign of dehydration. The second level is some dehydration or moderate dehydration. And the third level is severe dehydration. As prevention measures, the WHO talks about access to safe drinking water. It's important to drink safe water, potable water. So it will be preferable if you don't have enough money to buy mineral water to filter any kind of water that you have around you. It can be tap water, it can be water from a well or on any kind of source. So the least thing that you can do is to filter that water for you to be sure that it is safe. Number 2 is the use of improved sanitation. Number 3 is hand washing with soap. Number 4, WHO recommends exclusive breastfeeding for the first 6 months of the life of your baby. That will be very important to boost the immune system of your baby so that he will be more resistant to infections and then to diarrhea. Number 5, good personal and food hygiene. So when you are about to cook your food or when you have raw foods such as fruits and vegetables, it is important for you to clean them enough for you to make sure that they are safe. And for the tip that I was talking about in the beginning of the video, it's about Oral Rehydration Salts, ORS. These are considered as a mixture of clean water, salt, and sugar. So you find them in Pharmacist. ORS is absorbed in the small intestine and replaces the water and electrolytes that you have lost in your feces during your diarrhea. So it comes with water, it comes with salt, electrolytes. These are the two main elements. If you don't have enough money to go and buy them at the pharmacy, you have 3 ingredients at home in your kitchen that you can use to prepare an oral rehydration salt. First ingredient is water. So you take 1 liter of water. So in the 1 liter of water, you put a half teaspoon of salt. And as it is almost impossible to drink, to swallow salted water, so you will need to add some sugar. So you can add 6 to 8 teaspoons of sugar, or you can add as much sugar as needed. That will make it possible for him or her to drink it, to swallow it. So these are the 3 ingredients, and this is how you can prepare your own ORS at home. So you are about, or the patient is about to drink that water throughout the day, and it's going to replenish the patient with water and with electrolyte that will prevent dehydration and also fatigue, tiredness, and weight loss. It's important to note that it's not a treatment for diarrhea, but it will help you to prevent diarrhea. So you will still need to go to the pharmacy or to go to the hospital for your diarrhea, or for the infection behind your diarrhea to be treated by effective antibiotic or antimicrobial drugs. And there's another element that can be added, zinc. So you can go to the pharmacy as soon as possible to get a zinc supplement, because it's going to help you reduce the duration of your diarrhea episode by 25%. So thank you very much for having watched the video. I hope this has been helpful to you. Please consider liking and sharing the video, and also subscribing to my channel not to miss any upcoming video.